Hello, everyone. We'll give folks just another minute to get in, and then we'll get started. All right. So welcome, everyone. I think we can go ahead and get started. I'm Sharice Hamblin. I'm Dr. Hamblin. I'm one of the OB faculty here at UMass OBGYN program, and I'm new to this department and all of that. I am coming to you from wearing two hats, and so I want to just kind of get us started, and then Dr. Local will take it away, who is our residency program director. Um, 1 second to get my screen where I want it. Okay. Can you all see my screen? Wonderful. So, as I said, I'm Dr. Sharice Hamblin. I'm an OBGYN in the department, and I wear a couple of hats. One hat is as a generalist in the faculty here, and another is in the collaborative and health equity. And so I wanted to tell you guys a little bit about that, and that's kind of what got us to um, talking with you tonight, having this virtual open house specific to underrepresented medicine recruitment for our program. So the collaborative and health equity, UMass is committed to the health and wellness of our diverse communities throughout Massachusetts and across the world by leading in innovation, education, research, healthcare delivery, and public service. And so in the strategic plan for leading toward 2025, part of that led to the establishment of the collaborative and health equity, whose mission is to nurture and sustain community embeddedness and trust. Um, so we have these different pillars, and I leave one of the pillars, which is underrepresented in medicine, workforce development, and capacity building. We have a illustrious team, as you can see, and um, and specific to what I'm doing or what I do within the collaborative health equity is looking at, who is doing the caring matters. And when we think about the lack of or the low diversity numbers or low numbers of different people groups, it's a result of racism which acts at many different levels. And so when we think about that and we think about how we have, for example, in obstetrics and gynecology, worse outcomes for Black birthing people, and we can look at many different specialties, but there's a significant commitment at UMass and specifically in the OBGYN department to kind of be intentional about our recruitment. And so I'm really happy that Dr. Loco is so open and willing to kind of share this time and space so we can get some of your questions answered and tell you about this, what I would call a hidden gem in Central Massachusetts. So some of the things that we've done within the collaborative, as I said, I started in January, Black Maternal Health Week, really looking at how can the collaborative health equity and the OBGYN department, both working with the medical school and the hospital, work together to build bridges with the community in Worcester, which you're going to learn more about through our time together this evening. And we do some pretty fun things to engage the local community, which was one of these hands-on days, which our department really supported to give some youth some exposure into what our work is in helping and serving the this local community. And one of the other hats that I wear is as a medical director of the doula program. And so one of the very interesting things that we have here at UMass Memorial and UMass Chan is a doula program that's focused on improving the experiences and outcome of Black birthing people at our hospital, at our institution. And so if you guys have questions about that, we can get to it as we go on through our time together. Part of the work and part of my coming here is, and you might have heard of this or seen it on the Patients Are Waiting Instagram, which I'm the founder of Patients Are Waiting, which is a nonprofit organization. Our mission is to eliminate health disparities by increasing diversity in medicine. And so some of this work crosses a lot of these different bridges. So I'll stop sharing my screen, and Dr. Aloko, you can take it away.
Hi, everybody. Thank you so much for coming tonight. I really appreciate you all spending your time with us. We love it at UMass, and so I want to give you a little bit of information about our program here, and then also leave some time at the end for you to ask questions of us all, so you can get to know our program a little bit better. And I'm gonna just pull up a brief slideshow. This is really just an overview of our OBGYN program here at UMass. And then I want to try and explain, as Dr. Hamblin has done, some of the ways in which we try to weave in our really passionate focus on health equity into our clinical care, and give you some like sort of see that in the context of our program for you. I'm gonna pull this up just and make sure that we can all see it. Let me just share my screen as well. Oh, goodness. Okay. Are you all able to see that okay? Okay, so here I just want to show you a little bit where we are. We're in Worcester, Massachusetts. We're in central Massachusetts. We are the second largest city in New England. It's a really lovely, beautiful place, and kind of in the middle of many of the cities in New England. We have a strong clinical mission, really, of training people to be good generalist physicians, generalist OBGYNs, and also to be able to be leaders in their communities in terms of being is advancing our understanding of medicine, OBGYN, and healthcare, and also advancing equity in OBGYN care for our patients. We really value providing evidence-based care and equitable care to all of our patients, many of whom are underserved and come from very diverse backgrounds. Central Massachusetts is a very diverse area. We see patients who have had all sorts of exposure to the healthcare system, difficulties with encounters in the healthcare system, are from many different places in the world, speak many languages, and have various health issues that they're coming to us for help for. And so the idea of integrating advocacy into everyday medical care and anti-racist principles into everyday medical care is really important and kind of foundational in the way that we learn to think about OBGYN in medicine. So I really think that our residents, when they graduate and go out and practice in the world, have learned how to do OBGYN with this advocacy equity lens. That's the way the medicine makes sense to them. And I'm really happy about that and proud of that. We do also have mentorship and research programs and have some deliberate ways, both within our OBGYN program and then in our UMass graduate medical education environment, where we try to create mentorship and create community across the UMass Medical Center. So our residents really have good, strong connections and feel well taken care of while they're here. We recognize learning is for always. You'll learn a lot while you're in residency and then have to continue learning. And that's part of what we all love about medicine. And so, like I said, part of that is learning how to approach OBGYN and approach medicine with the lenses through which you want to continue to seek out and integrate new information into your knowledge that you already have. And we do have quite a team approach here. We have our faculty physicians from multiple different specialties, and our OBGYN physicians are very interdisciplinary in their own niche interests and how they collaborate across the institution. And then we have APPs like midwives and nurse practitioners we work with pretty closely. And there's a lot of very close feedback between the residency and department leadership in terms of continuing to always change and improve the program as needed. Our residency program is 6 residents per year. This is a really recent expansion and one I'm super excited about. We've had a lot of really great changes in our schedule over the past few months because this year was the first year we were able to match 6 residents. So I think that gives a little bit of extra educational time to people and allows us to take really good advantage of all the good clinical learning we have. We have about 12 blocks per year. We do use a night float system and residents get 4 weeks of vacation every year. We do have exposure to all of the subspecialties pretty early in residency, which I think is important for you being able to visit those subspecialties during multiple points and at multiple different levels of understanding. And then also the exposure allows you to decide what you want to do with your career. And we're probably about 60-40 generalist and people who want to go into fellowship. And where I talked about that individual, more tailored mentoring, part of that is about career development, and fellowship matching is a part of that. So our mentoring does also take into account career goals, both discovering them and then achieving them. And we do have an elective in the 3rd year that lots of people use for away rotations, research, or just if they want to be in the OR more, they can use it for that. Our clinical sites are all pretty close together. Everything's within about a mile here in Worcester, with the exception of if you wanted to do an away rotation. Like I mentioned, this is it's a very diverse city. It's a pretty livable city and the 2nd biggest city in New England. So you'll find lots of things to do. But I think you'll also just encounter lots of people from different places with different perspectives, which I really love about Worcester. We do have a didactic curriculum. Ours is concentrated once a week and includes lots of lectures, interactive sessions, sim and skill sessions. We do have an advocacy curriculum in our resident core. It was started, I want to say 3 or 4 years ago, by a couple of the residents who wanted to explicitly make advocacy chiefing one of our chief roles, along with the scheduling chiefs. So they developed this curriculum that has been carried forth. And we're fortunate that this is not just in the residency didactic curriculum, it's really also a common thread through our grand rounds departmental teaching, and then also our faculty development and just a lot of our conversations and about the department and the hospital in general. We have lots of skills simulation. This is interdisciplinary, and we have several other different learning conferences throughout the week as well. We have a research curriculum so that you can learn the value of research. Research does not often actually mean bench research. It sometimes means clinical, it can be quality improvement. There's lots of variations on this, but we will help you get it done. And you can then also, presenting or not presenting, be able to go to conferences and participate in other academic activities throughout the year. The residents really, they have time set aside every year that they're able to use for this. Some of the residents choose to use this for advocacy activities. So our residents every year go to state and national advocacy days and participate in directing legislators around different OBGYN topics. We are very fortunate in Massachusetts that our family planning, abortion care is well protected by the state, and the state is making moves to improve maternal morbidity and mortality with actual legislation and programming. And those are some of the things that our residents have been involved in advocating around. So I'm very grateful for that. And I'm also grateful that our state actually has a very good state health insurance program too. So when we're thinking about ensuring equity for our patients, the health insurance enables us to do a lot of things for them, making it a nice place to practice. I really appreciate the great Commonwealth of Massachusetts in that way. I mentioned that we're in a very abortion-friendly state. We do have a family planning rotation, and our residents go to Planned Parenthood in Worcester, and then also do family planning procedures here in the OR. And this is really integrated into the clinic as a whole. Like, our abortion and family planning care is not specific necessarily to the family planning rotation or service. It's sort of embedded in everything across all of our clinical areas. I mentioned that we do have our individual mentoring. The residents are matched with a faculty mentor who provides support for fellowship, career decisions, anything that the resident is interested in. We have affinity groups across the university as well, which I think further develops the community that the residents have here at UMass. And then we also have time set aside for team building activities in the residency class. Our residents went to go flower picking last year. This year, they just got back from a hike and brunch, which was last week. So they do have time where they just get to forget for a second about the hospital and spend some time together. And they arrange lots of things outside of work as well as what's set aside in work. I did mention that our class is probably 60-40 going into generalist practice versus fellowship. And generalist practice meaning either private practice or academics. We have here at UMass a large faculty group with all of our subspecialty divisions, and we also have a couple large private groups, and the residents really interact with everybody very similarly and are involved in care of almost all of the patients, both on labor and delivery and in gynecology in the OR and on the floor. So there's really good exposure to multiple different ways of practicing. And then Dr. Hamblin had presented some information about the collaborative and health equity. And there are some other things going on at UMass, some other initiatives that I think also really are coming from a place of health equity. I mentioned that we have people from many different places in the world speaking many languages. We have very, very comprehensive interpreter services that are very available. We have a team birth system on the labor and delivery floor to provide patient-centered care and have through the collaborative and health equity, and then just also because of all of our own personal interests, we have concentrations on DEIB initiatives in some of the work groups and regular meetings around particularly labor and delivery. And members of our department have been very involved also in care for LGBTQ plus patients, explicitly in providing surgical care for transgender and genderqueer patients. And that we are really the place in central Massachusetts where people are able to receive that care. And then also always, I think it's important to think about how we evaluate our approach to equity. And this is, health equity is it's a lofty goal. It's a difficult thing to achieve it. So we always need to evaluate and learn from decisions that we've made and think about how to take best care of patients and our colleagues in the future. And so we always try to bring up health equity issues when we're doing our M&M, now we call them quality safety review conferences. But when we're talking about patient cases and evaluating our care, we very explicitly consider health equity considerations. That's a very quick overview of our program. I think that we have a really lovely program here at UMass. We our very enthusiastic faculty and residency program. And I think our residents graduate with fantastic clinical training and really a great outlook on how to be really impactful physicians once they graduate. And I was a resident here and I loved it so much that now I will never leave. But I would hope that that gives you some sense of who we are here at UMass. And we have a ton of time if you have questions about anything here related to UMass in a health equity sense, in a clinical sense, or training. We'd be happy to answer those questions for you. I'm going to stop sharing for a minute. I'll put up the chat too. Oh, I love that you all are from all over.
Yeah, I'm a chat fiend, so I've been in there kind of poking around. But feel free to come off of mute and ask your questions. We do have a couple faculty on, and then as I pointed out, our department chair and Dr. Johnson Obak, who's the executive director of Collaborative and Health Equity. But yeah, feel free to just come off of mute, ask your question, and we'll also address things in the chat.
While you are all are preparing more questions, hi everyone. My name is Krista Johnson Abaku, as Dr. Hamblin said. I'm really happy to be here with you all this evening. I am also a fellow OBGYN in the department and joined almost a year and a half ago now. And I'm really excited about the work that Dr. Hamblin is doing, not only in OBGYN, but also through the collaborative and health equity that I lead. And I just wanted to make just a really point of emphasis in that, you know, representation is so crucial because we know the growing evidence in the literature on how communities, especially communities of color, communities that have experienced historical marginalization, both past and present, we see the data that shows that if you can increase the diversity of the healthcare workforce, the entire care of these communities is improved. And so we are very intentional about leading in this way and leading in these spaces in what we're doing, especially with the new innovation and programs that we've brought since we've joined UMass Chan that I'm so excited about. And for me, mentorship is everything. It's been my own personal trajectory in medicine, but it's also how I lead in terms of how I center, how we, as faculty, invest in our learners. It starts even before they enter medical school, which is what Dr. Hamblin has championed her entire career, but also in terms of how we could really be the face of how we want to say to each of you who are considering, your choices, that you're going to get excellent training as a clinician in OBGYN pretty much anywhere you end up. And what we really want to emphasize is that community of support that we want to make sure that you have so that as you go through that journey of 7 years of training, right, that you can look around and realize that you have a bedrock of and pillars of support around you who are there to ensure that you can, weather whatever challenges that might present your journey into your, chosen career path, and that we can, make sure that that there are people that you can lean on, that can be safe spaces, that can really pour into you in terms of crucial mentorship, sponsorship opportunities, or just a colleague that may have shared lived experience or congruence with what you've journeyed and can be an anchor of support for you. And so that is so crucial as you think about where you might want to consider training and as you go on the interview season to really think carefully about what you see when you visit these various sites, whether in person or virtual, and who you interface with and what are they saying more than what's, on the websites or what you can glean otherwise, but really, how will you feel confident that you will be supported in ways that will enable you to not only survive but thrive? and be able to get the kind of mentorship that really sets the future in terms of your career trajectory and what you choose to pursue in this field. I wanted to speak specifically to the community work that was mentioned in the chat. One of the first questions I see in terms of the interplay between being integrated in community-led initiatives. I really wanted to speak to that's really the strong anchor that I'm seeking to do here at UMass through the collaborative, and that we are really driving intentionality in how we engage our learners, not just medical students and nursing students, but residents and fellows in training, and how we center really increasing our intentionality to how we build trust with communities who continue to experience marginalization. And in so doing, we need to have representation, but also really leaning in and recognizing the pillars of structural racism and social drivers of inequities that are undergird everything that we see, that explains the persistent health disparities in communities, especially disparate communities. And so we really take that seriously in terms of how we are seeking to invest in these partnerships and relationships, centering these voices, bringing those voices in to have a seat at the table in helping to drive approaches to care and research and that really reflect the community's voices and lived experience and really brings our learners in the forefront to how we do that and how we lead in those spaces. So I just wanted to speak to that. And absolutely, I think this weaves very well in with advocacy efforts as well that you've seen that Dr. Alaco showcased. So I just wanted to say that this is something we absolutely are leading with at UMass Chan and UMass Memorial Health. That happy to talk more if anyone is interested in learning more, but there's a lot that's happening in this space.
Dr. Moore-Simus is here. Dr. Moore-Simus is our department chair here at UMass OBGYN. Did you want to say a few things, everybody?
Yeah. Good evening, everybody. So Tiffany Moore-Simus, thank you for taking the time to be with us this evening. I just wanted to maybe elaborate on some of what has been said and speak to some of what is in the chat. So people will often ask me, like, what is your vision for this department? And I think, when you go from one institute or, institution around the country, they're not that original, right? It's like excellence in clinical education and research. But I think the thing that I have always particularly appreciated about UMass is sort of that pillar of equity certainly is more recently expressly added at a pillar around service, and really a deep dedication to serving our community has been there. And, when an opportunity comes up, we think it. So for example, I often get the question on, what changes do you see? So many changes, right? Change is constant, but we do have some space changes coming. And in doing that, thinking about very purposely, very specifically, what is proximate to what, right? In current state, we have a resident clinic here and we have a faculty clinic here. And like many places, it gives that perception of if you are a particular demographic, you go here, and if you are another demographic, you go here. And I will say, when you look at the demographics of our faculty versus our resident populations, they are very, very similar. But it's still, having two separate spaces has given that sense of like there's different care. And so we're going to bring those two together for very, in promotion of equity into it, to assure that in fact the care is, as it should be, of the same quality and caliber, regardless of who you are and where you get care. And also in thinking about the space and these spaces changes, it gives us an opportunity to think about our naming nomenclature. So our inpatient obstetrics unit is still called maternity center, right? Our ambulatory centers are, unfortunately still called women's centers. So thinking about, more inclusive naming, right? We just established, or have put out a call to establish a task force and making sure all the voices and perspectives are at the table. We're going to change spaces, signs are going to change. This is the perfect time to make sure that we are purposely addressing that. So just being present, thoughtful, purposeful, and having those perspectives at the table is, and really serving our community are things that I have always really valued. Are we a mecca of equity amidst a desert? No, right? We still have work to do, but I think we have a lot of people here that want to do the work. also happy to answer questions live and in person or otherwise offline.
You guys are probably watching my face as I'm like typing ferociously in the chat.
I love the chat. You all are asking so many good questions.
Yes, please, please come off of mute. And, Natalie knows this, that I'm relentless, but through all means of communication. And Natalie's a fourth year here at UMass. And I just mentioned Tiffany, who was on labor and delivery right now today. So yeah, please, like, we want to get to know you. It's not meant to be something where we're just talking at you. Um, it's like what's the pickleball, not tennis? Yeah.
Yeah.
Yeah, there's a question about community-led initiatives. Certainly, Krista and Charisse can speak very passionately about this if it hasn't been stated already. And then we have, a number of PCORI-funded projects that are really, led by our community advisory boards. And as I said, like in this naming task force, it's to make a more inclusive environment. We, of course, should have at the table those that identify as genderqueer, transgender, what have you. And so making sure we bring the community into the conversation and that they're really a part of it.
I think someone asked about what practices are offered for inclusive care for transgender and genderqueer patients, but I was also wondering if you offer any specific certifications for providing that care.
So happy to at least start the conversation. Other people can sort of, bounce or popcorn back and forth. But so we do have what's called the Rainbow Clinic. So Rainbow Clinic is led by one of our faculty. Her name is Gina Sullivan. She has done some more advanced pelvic surgery training. And so she does a lot of our gender affirming care from a surgical perspective. All of our residents operate with Gina. She is, in our general OBGYN division, is sort of MIG certified surgeon and has a large patient population of those seeking gender affirming care. And then we do have our REI division was recently very small. We have a number of REI providers joining us in the short term who will also be participating in sort of more hormonal therapies.
Thank you.
As far as a formal certification, we do not.
I will just add to that, Dr. Morsimus, also that the Rainbow Clinic is really drawing together people across UMass in an interdisciplinary way. So Dr. Sullivan is a gynecologist on the team, but this also includes other surgeons and endocrinology providers. And also a lot of our primary care providers have been doing hormonal medications, have been prescribing those to patients for a long time and are very comfortable with it. So it's another thing that exists both explicitly in something like the Rainbow Clinic, but is also sort of woven through and embedded in the care provided in general to patients at UMass.
Thank you. Yeah, Dee Dee Blake, who's one of our pediatric and adolescent specialists, starts care early and continues on through the adult spectrum, along with mental health providers who are part of the Rainbow Clinic.
Dr. Hamblin had put some information in the chat about the different groups of people in terms of country of origin in Worcester. And so Dr. Hamlin has a great link in there, data from Worcester, Massachusetts. It is a quite diverse area, and I love it for that. We do have a very large group of people from Brazil, many places in Central and South America, as well as a very large Ghanaian community. I should also say that we do have a lot of people in the Worcester area who are here as refugees. Our family medicine colleagues have a very busy refugee health clinic. And so we see a lot of the same patients. So we see them maybe for their gynecologic care when they need it. But we do have a large refugee community in central Massachusetts.
Liz, there's also a question regarding our awareness of issues of equity and equality and reflecting how we look at residency applications. Do you want to speak to our holistic review process?
Yes, we have a holistic review process. Everything is done intentionally, and so when we're looking through the applications that we've received, what we're trying to do is just figure out everybody's story, really. And so we are not using cutoffs to review our applications. We just want to read through the application really intentionally and get to know people and understand your journey to medicine and OBGYN and understand maybe your journey to UMass. And so in reviewing those applications, what we're really valuing is the person and your expression of yourself as a person in the application. And so in reading the applications, we do try to keep track of things using a very holistic rubric, taking into account people's journey into medicine, the other experiences that they've had outside of medicine. And it really very much de-emphasizes things like test scores, which are just not as meaningful to being a great resident and a great physician. And then we're very intentional in using that information to offer our interviews and hope that in doing so, we're able to interview people who we will mesh well with us and can sort of continue our commitment to health equity and really serve our patient population well here at UMass. So absolutely, it's holistic. That will stay the same with our new application review system, which is designed to make holistic review very possible and easy, I think.
And then there's a question around robotic certification.
Oh, yes. Our residents do learn robotics with the oncologists, generalists from both the faculty and private groups, and are able to graduate with robot certification and feel comfortable doing the robot outside of residency. They learn bedsiding first and then sit on the robot, but the residents, if they want to do the robot, are able to be certified easily out for their practice outside of residency. This is also a good question for you, Dr. Morsimus. What you loved about UMass to stay here as an attending.
I usually say, in the interest of full disclosure, I was first generation college, first generation med school, and came to UMass as a student, stayed on as a resident, and stayed on as faculty. I've grown up in this system, and now I am chair here. And what I will be honest and say what attracted to me to UMass initially was small tuition payments. What has kept me over and over and over and over again was the people and the opportunities. So that is the truth. When people ask, what is your favorite part or what's the best thing about UMass, I say the people, right? We care for each other, right? And people will talk about family, but there is your biologic family and there's the family you choose. And this has been a wonderful chosen family. And so there's a lot of caring and compassion, collegiality, kind of all the C words, which sounds very I don't know, tagline, but it has been my lived experience, and just the opportunities around mentorship and sponsorship, was those are my children. There was, my mom was a stay-at-home mom who drove school buses, and my dad was a carpenter, right? The path I have taken is something completely foreign to them. And I went to med school not appreciating something called residency followed. And so I have very much benefited from the mentorship of those who've taken me under their wings. And so I, continue to do that myself for others and have appreciated those that do that along the way. And I think there's a lot of spirit of that here.
I would agree with that and also say that Dr. Morsimus's mentorship is something that's been really lovely for me here as a more junior attending. And I think that the collegial environment really allows us all to work on improving our knowledge and our skills together. It's a place where we all are working to learn more, know more, take better care of people. And we can do that together and help each other because we have very good relationships among all the people who are here. So it's an environment where we are able to work together to continue to improve our care of patients. There's not a lot of it doesn't feel like a competitive environment or any like a hostile environment. We're really trying to work together here. And everybody has their own particular interests and things they've chosen that is their clinical area of interest or clinical strength or an academic strength. And I also love that about the department, that we each have an area that we're really, really passionate about. And then when we put the whole department together, we represent a really wide range of skills and interests.
There's a question about kind of global outreach. So I will say that in current state, Eurogyn and MFM have collaborations with hospitals and healthcare systems in Rwanda. And then MFM, particularly Dr. Lefwich, has collaborations in Kenya. Interestingly enough, a former SVP here at UMass reached out who's running a global health organization, was like, can we meet about? Particularly they're interested in growing, MFM presence in, oh my gosh, the country's name escaped me at the moment. It'll come back to me or I will look and find it. And historically, a number, in particular, one of our private practice groups has gone to sort of a long-standing relationship with a hospital in the Dominican.
And the next question I see is a question about an example of a time a resident had a personal issue or emergency and how the program supported them. This honestly comes up often. It comes up all the time. Residents are people too, and so emergencies come up. And so one of the really remarkable thing I think about our residents is they're just so supportive of each other as well. So recently when this has happened, when a resident has had a family member be sick or pass away unexpectedly, what we do is I, as the program director, sort of get together with our admin scheduling chiefs, and the first priority is getting the resident to where they need to be, understanding if the resident is unexpectedly sick, what is going on, making sure that they get home and they're doing okay, and then making a plan for coverage. And so the residents are very, very wonderful about covering each other when an emergency comes up, and we just sort of adjust where people are. And then that means also that attendings for our covering service are very understanding about these short notice changes in resident coverage and changes in who is where, and if a service has to be left uncovered for a short period of time, all of this trying to still maximize everybody's clinical experience and learning during this time. But that flexibility allows us to make sure that when somebody does have an emergency, we're able to let them leave for a short period of time, like let them go, take a week or 2 weeks leave, is how it's happened most recently. And then keep in touch with them the whole time and provide the support that they need to get through whatever is going on and follow up. And I think that the ACGME and also our UMass GME office provides a lot of support for that as well. And I'm really appreciative of that because it didn't used to be that way in residency, but now we're able to have the residents do what they need to do in their regular everyday life. our GME office does provide support for coverage of call shifts when residents are out on parental leave, which I think is a relatively unique thing. And so when other residents are picking up extra calls while somebody's out on their parental leave, those calls get compensated with funding from GME and don't need to be made up by the resident who is out, which makes it just so much more possible if that is your plan during residency, makes it more possible for you to have a reasonable amount of time in that immediate parental period. I don't actually think that many programs are able to do that, but that's a policy across all of our residency programs.
All right. If people don't have questions that are popping up, I'm going to ask some good stuff. Are people married? Are they single? Like, what is Worcester like? Do these people have social lives? We're going to be giving up some of our 20s and 30s here. Talk about the scene.
Our residents.
Happy to talk about that. I am married. I've been married for 22 years. I have 3 kids. I met my husband in Worcester, but a long time ago. Probably more appropriate for some of our residents to speak to it. I mean, amongst our existing residents, there's a variety of people who are partnered versus not partnered, have kids versus don't have kids. All are welcome.
I think we're pretty evenly split between cats and dogs as well. For babies.
There is a bit of a scene, I would say. You know, Worcester has been deemed by some the Paris of the new millennia, or that's the I would say, I've been in the city for a long time, and people have talked about its renaissance and its resurgence for a lot of years, and it's here. It is, there's a lot of kind of food places, sorry, those are my children. I don't know if you can hear them. Oh, okay. I'll stop mentioning them if you can hear them. Like microbreweries, and just there are 11 colleges and universities in Worcester, so it does kind of have a young person city feel to it. Therese, you're the sort of newest to the community and in sort of the hubbub, I think, of what is sort of our newer, more hip downtown. What's your impression?
I'm forever young, but I'm not single. But yeah, but there's some things. There's places to go. You can eat your way through Worcester. My family is kind of stuck on going to every Caribbean restaurant they can find because we've only had one for a long time and we're from New York. So like we were in New York and then we moved and now we're like, oh, we got options. So that's been pretty fun. Sammy is our program coordinator for the Collaborative Health Equity, and she's got the young, she's got the scene. She knows the young scene. Tell us something.
Hi everybody, I'm Sammy. To toot the horn of the many colleges in Worcester, I am a Clarkie. I graduated from Clark in 2023, and I loved Clark and every minute of it, and I'm so glad to still be in Worcester. Worcester has a lot of good food. I'm a big fan of Bay State Brewery. They have good parking. Frankly, there's a lot of good restaurants in the area, and for me, it's like the parking, finding a good spot, but it's very drivable. There's free buses around the city, and basically any kind of food or brewery type of thing you can always find here.
Right, live music, sporting events, art museum,
and Sunday dinners.
Live performances, right.
We have Sunday dinners, which is hosted by the Collaborative and Health Equity, where we get catered food from a local business in Worcester. And we have doctors, residents, students, everyone from UMass kind of comes over when we get to try some food from Worcester. So there's a lot of good stuff going on there as well.
So in our final couple minutes here, just you can ask hard hitting, or if you want to just please feel free. I know lots of programs do this, but I think go ahead, Sydney.
Sorry, just didn't want to interrupt. First of all, thank you guys so much for putting this on, but I just wanted to ask from the residents' perspective, like how well do you feel like you're kind of being heard from the faculty? You're able to give the faculty feedback, and if there's any initiatives that you have kind of been able to like spearhead or lead or anything like that, if that makes sense.
Not seeing many residents on here. There was.
Yes, I don't know if I see
Fell off,
this
yeah.
on.
If it means anything, I get a lot of emails and conversations with feedback.
I think, in terms of interaction between faculty and residents, we are working together literally all the time. And so building good relationships from that standpoint. I go and do kind of like feedback check-in sessions with the residents about once every 2 weeks at their resident didactics. Dr. Moore-Simus comes about once a month as well. And so we are able to do some really good troubleshooting of issues. Residency programs are evolving all the time, and needing to change all the time. Even from when I graduated to now, we've made some really significant changes. And so meeting frequently allows us to keep track of everything that's going on, and then helps me understand what the residents are concerned about at any given point in time. And so things that have come out of that are changes in the way that our clinics are staffed and who is doing what. It had become really burdensome that a night float person was working in one of the clinics. And so the residents were able to figure out a switch that has worked really well, and be able to lead that. The residents provide faculty feedback. We have an evaluation system that's anonymous, so the residents are able to easily provide anonymous evaluation. And then if they do not want to be anonymous, they are able to talk to me or Dr. Moore-Simus or really any of the faculty members very easily, because we're always around and pretty accessible. And the program, like we really do try to make changes as we're able to. There's been a lot of really good changes over the past year, with the schedule changes we've had to put into place with the sixth resident. It's definitely not perfect, and we're already seeing some things that need to change in the future, but we don't have to wait a whole nother year to make those changes in the schedule. And then the residents are pretty involved in a lot of the committees around the hospital. And so we work pretty hard to get the residents to meetings or to get resident input on various changes that are going on or committees that are happening. Like right now, we're working on some space redesign on labor and delivery, and the residents have had a lot of input into that, and how we're setting up one of the spaces on labor and delivery, one of the workrooms. So they do have a lot of input, and have a lot of different ways to be able to provide their ideas and provide feedback. Some of those are anonymous and some of them are not. And that seems to work pretty well to have that balance between the two. Does anybody else have questions that they feel like they haven't had answered yet? I see one in here actually about resident feedback. I would say residents receive feedback often in the form of teaching. We're working very closely together. And so I think a lot of the feedback that I give the residents is about we're doing this case together, and like this is going really well, and this is something you're still working on. And so I think the residents receive feedback often in that way. I meet with everybody at least twice a year and go through feedback that's come through other avenues like evaluations. One really wonderful part of the mentoring program that we have is also some training of the mentors which has included some faculty development work on giving feedback. And it's, I think, a difficult skill, and good that we're like explicitly paying attention to how to do it in a productive way, because you're coming to residency because you don't know how to do OBGYN yet. So it's just a natural thing that you're going to need feedback and teaching. Otherwise, you wouldn't need to do residency. And so it is, it's good for us to be able to do it well. And that's something that I know I am like right now at this moment particularly interested in. That's sort of like my focus for this moment in time for my own learning.
There was a question about robotic surgery. So you get, so basically when you do residency, what is included in your residency goes to like when you're applying for your first job, like your core privileges. It's afterwards that like people are trying to get proctored or something like that in the cases. So when you do robotic, like you'll have your case log, and that's what you present to your next institution when you're going there. And so you have your privileges. It's not a separate certificate that you get.
And I think a couple people have wondered a little bit about autonomy and in interns, and I think that our program does have a really nice balance of autonomy and supervision. The interns do not have to wait very long before doing deliveries and C-sections and surgeries, and they are involved in everything. The residents are involved in all of the procedures, and so I think that there's a nice progression of autonomy based on what you have done, what you're currently working on, and it works really well for the residents to talk to the faculty to say what they're working on or focusing on. That is it's very much in the spirit of the institution where we want to be able to help you become independent generalist OBGYNs by the time you graduate. And then there's also a lot of teaching by the senior residents. We try to get our senior residents together with the junior residents in procedures, especially in deliveries and gynecology procedures, so that especially the residents who are interested in continuing on to work in a place with learners are developing the skills to be able to teach OBGYN. Teaching OBGYN is also a great way to firm up your skills, even if you're not going to be working in a place with learners. And so there's a lot of time spent with the chiefs teaching their juniors, and then as attendings, us helping the chiefs learn how to teach their junior learners. But I would say you will jump right in at UMass and start doing things on your first day of residency, which is so exciting. But there's always somebody there to help you out. Even as an attending, I feel like there's always somebody that I can call to help me out if I need something. And that's also because this is a pretty collaborative place, and there's always somebody willing to help me.
Awesome. Well, thank you guys so much. I know we're at was someone gonna have a question? If you were, it's okay.
I did have one more question. I just didn't, since there weren't residents on here tonight, I didn't know if there were going to be other opportunities to interact with the residents like before like interview season starts.
There is an ACOG virtual residency fair for our district, which I think is on September 7th, that we will have some of the residents at. This is unfortunately also occurring around the time of sign out, so I imagine that they were a little bit pulled into patient care and sign out. But we will have residents there. The residents usually also run their own kind of more social residency open house. I don't know that they have a date for that yet, but they really like to get together just among themselves and also talk to all of you about the UMass program. We do have an Instagram account, and so you'll be able to find out some more information there. Follow or whatever you do with Instagram. Is it following? Click on us.
Awesome. Well, thank you all so much. I'm gonna put the links that Sammy put earlier back in for anybody who came in later. Feel free to follow on Instagram. There's multiple sites. The Collaborative in Health Equity, the OBGYN residency program. Patients are waiting. We now have your emails, so we will pepper you with ways to stay in touch. If you have questions that come up afterwards, feel free to email. We'll put our emails in the chat. And then again, there will be other opportunities, but we're happy that you spent this time with us, and I hope you got your questions answered. It's really great to meet you all, and thank you for coming.